Hello, Barbara. Hello, Bill and Wendy.
Hi,
Marta.
Hello, everyone.
Join us. Hi. So we're going to get started in just a minute or two to get settled in. Thanks for joining us. I think we're going to get started now. It's the top of the hour, and we have a fairly full agenda for this webinar today. Welcome to today's webinar on data tools, dashboards, and digital technology for immunization supply chains. Just a reminder, as we always do, we are recording this webinar, and we will share the recording with you after the webinar is completed in our follow-up email, and I will also share the slides with you of the session as well. My name is Barbara Lamphere, and I'm joined today by my colleague, Bill Keogh. Bill, please go ahead and introduce yourself.
sure. Hi, glad you could all be here. My name is Bill Keogh. I'm a talent and organizational strengthening advisor here at JSI. I have about 25 years of supply chain consulting experience, helping organizations optimize their supply chains. And I also have a lot of e-learning background. I currently serve as a professor at the University of Washington. So welcome.
And many of you know me already. I'm Barbara Lamphere, Senior Technical Advisor, JSI, working in organizational strengthening and capacity building and a number of programs across a number of geographies. We will be joined later today in the webinar by two colleagues from UNICEF, Marta Fernandez-Arias and Dorta Conradson, who will be sharing some of their experience creating the web version of a tool you're very familiar with, the stock management tool, as well as the Viva tool, the visibility for vaccines tool, which is a pipeline monitoring and procurement planning tool.
Okay, so this is the second webinar in the series, Improving Data Use in the Immunization Supply Chain. So we hope you can join us for some of the future webinars. For the next two, we're going to be focused on data triangulation. In the next one, we're going to be joined by our colleagues from Village Reach, and we're going to talk about data triangulation and also how it can improve decision-making in the immunization supply chain. As I mentioned, the first is about data triangulation specifically, and particularly how it's been used in Mozambique. And then the second webinar about data triangulation is going to be 1 week after the first, and it'll be in a slightly different format. We're going to start with a country example from Ethiopia, and then we're going to have more of an interactive workshop format talking about the actual application of data triangulation.
I just want to remind you, and I hope you're taking advantage of the webinar series that's already ongoing on temperature monitoring. These webinars explore the different technologies that are available for active temperature monitoring of your cold chain. The slides and recordings for the first two webinars, which have already taken place, are available at the TechNet 21 website, and I'll share that website address with you in the follow-up email. And you can still sign up for the next three webinars which, at that same address.
Okay, so as we kick off here, if everyone could take a moment and go into the chat and just quickly introduce yourself. Tell your colleagues what your name is and where you work. At the end of the presentation, there'll be time for questions. If you want to pose a question during the actual session, please use the chat function. You can click on the Q&A button there as well, and that will also work. Now, on to the webinar.
Right. And I'm seeing so many familiar names in the chat. Great to have you with us again. All right. So to recap what we did in the last webinar, we reviewed the data needed to manage the immunization supply chain, including logistics data for operations, program data. We looked at sources of data, and we looked at actions to take to improve data quality. In this webinar, we are going to focus on our attention on data tools, digital tools used to collect, report, and visualize data, and discuss some of the considerations, challenges, and lessons learned when implementing or using data tools in hopes that any implementation that you have will be successful.
Okay, so as we all know, there are a lot of tools out there, and they come in all different shapes and sizes, so to speak. There are paper tools, there are digital tools. Some tools are mobile-based interfaces that connect to a back-end or a web-based tool. And then a lot of these have great dashboards that help you analyze, visualize the data, and use that data to make actual operational decisions. But regardless, that's the important point, right? The only reason you collect data is to help you make decisions that will improve how you do your work on a daily basis. So digital tools have a lot of benefits, right? Paper tools, well, it's time consuming, first of all. But one of the things about paper tools is they don't capture the data in a way a system can use them. So digital tools, they standardize data, they make it easier and more streamlined to actually connect the data. The data aggregation and reporting, in other words, the rolling up of data from the lower levels, it makes it the workload less. It also makes it faster, so you can transmit data more quickly between one tool and maybe a back-end database. When I talk about the database, right, on the back end, you want to make sure that it's secure. And so web-based and digital systems hopefully ensure that. Usually there's a lot of attention to security since the data is sensitive. Digital tools can improve the quality and reduce the number of errors you have in your data, and we'll talk about that in a little bit. Digital tools increase visibility, right? Paper is very difficult to distribute, and somebody's not going to look at 500 pieces of paper and try to figure out what's going on across the entire organization. Also, it makes it easier to make decisions when you can see that data in a way that's rolled up or sliced and diced any way you want. And then at the end of the day, having digital tools helps improve the performance of your supply chain. Okay, so like anything, there are good things and positives, and there are also some challenges associated with digital tools. One is user support, right? So a digital tool, no matter what it is, people need to get trained on it and they need to get comfortable. And during that time, it's a bit more work than doing what you have always done. So that can be one challenge that needs to be addressed when a new tool is rolled out. Obviously, electricity, internet, mobile phone, That kind of infrastructure is sort of critical to be able to use digital tools. Some of them have functionality where you can use them offline and then upload data, but nevertheless, you need those three things really for a tool to work properly. For users, they need to have some familiarity with a digital interface, with technology, how to use a computer, that sort of thing. And then choosing the right digital information or actually developing the sort of software that's gonna capture the sort of data you need. That's, I think, as most of us are familiar with, that can be complicated. Standardizing the identifiers of data across tools. This is what's called in a database a key, so that the right data is connected to the right other data and the data is the same across systems. And again, we'll talk about that in a minute. Organizations need to be able to host and also to improve the applications and to maintain data, possibly on local servers. Now maintaining stuff in the cloud is easier, cheaper, more secure, more effective, et cetera. So a lot of applications are moving to the cloud. You need to figure out how to scale up, right? So you start with a pilot, you find out what works, what doesn't work, and then you figure out how to deploy it more broadly. And then sustaining these solutions is not cheap. So there has to be some budget associated with this. There has to be some thinking about if everyone's going to use a mobile phone, who's going to pay for it, how is that going to work, that kind of thing.
And I do want to emphasize this idea of planning for sustainability at the concept stage of your implementation, at the beginning of your planning for implementation. Because if you start in a pilot and have not planned for that and you successfully decide to scale up, it's a little late to begin planning for how you're going to maintain the product, how are you going to manage the databases, who's going to take care of it. So I think it's really important to do those early on in the design and planning stage of the implementation. So another consideration when thinking about digital tools is what are the digital tools that you're going to use and what functions they're going to support. Some digital tools are available as single applications and serve a single function in the supply chain management. So for example, we have the WHO District Vaccine Management Tool, an Excel-based reporting tool that many of you are familiar with. We might also have a separate cold chain tool, such as the Cold Chain Equipment Manager. PATH has developed a Microsoft Access-based tool that's designed for that management of cold chain equipment. And so you have tools you can have tools that are for separate functions of the supply chain, but better yet is to integrate those tools into an ELMIS, like the VLIMS system that we saw in the last webinar, that was demonstrated in the last webinar, and that integrates program data and logistics indicator tracking, remote temperature tracking, and cold chain equipment management in one place. For example, there's a VLIMS used to manage vaccines and cold chain equipment. The one used in Pakistan supports a range of supply chain functions, from remote temperature monitoring to procurement planning, and also replenishing facilities. So all those functions are integrated into the web-based VLIMS. The advantages of an ELMIS, VLIMS, whatever you want to call it, it can allow for vaccine tracking in real time and reduces reporting errors. You're not transferring data from one tool to another tool. And it obviously, reporting can be automated. It can be used at multiple levels of the system, depending on your infrastructure. And studies have shown that actually having a VLIMS or an ELMIS leads to better data quality and more data use for vaccine management by easing the access to that data through the VLIMS. Often associated with a web-based LMIS and certainly a great digital advancement is to have mobile phone applications that are useful for tracking vaccines and also warehousing and other supply chain functions. So mobile phones applications, which are associated with the web-based VLIMS, are often used for data collection, for reporting, for supporting operations such as distribution planning and stock management. They can be either web-based, the mobile phone applications are often web-based, but if you don't have web-enabled phones, if that technology is not easily available or is not user-friendly in the infrastructure available, then SMS or similar technology is also possible. It obviously has the benefit of being portable and available when decisions are need to be made. And it can often be used offline and then synced with the larger system when connectivity is available. So here are two examples of mobile phone tools. Embrana, which is used in Ethiopia and has both a mobile and a web component. It's a vaccine inventory management system. And it actually was developed in response to challenges that the Waredas, the districts in Ethiopia, were facing in connecting with the commodity management information system, the web-based system. So it's interoperable with the upstream system, and it syncs with the national dashboard. A similar system is EVIN, which is also mobile and web-based and has been deployed in India, and is a tool that was developed by Logistima. And it is now digitizing the vaccine stock and information for 27,000 vaccine storage sites in the nation. And it's credited with contributing to an 80% reduction in vaccine stockout instances because that data is available, and they can see supply chain performance, and the data is shared more readily through the EVIN system. They have been able to improve their supply chain performance. All these mobile tools should feed into some kind of performance management system such that is visualized through a dashboard. And we looked at dashboards last time we were together in the last webinar. We looked at the VLIMS dashboards. And dashboards really can transform data into practical and actionable information through charts and graphs and visuals that provide you with information to improve performance, to see what's happening at different levels in the system, to see trends over time. It's really important that dashboards help you gather information on a series of performance indicators, such as these that are seen here on this slide. We looked at some of these performance indicators last time, but stock out rates, stock status, reporting rates, status, cold chain equipment, all of these things can be visualized to the dashboard. If you remember from our VIM system that we looked at last time, these are two graphics from those systems that helps look at status of coverage, as well coverage of vaccine coverage. And this is the district vaccine stock summary to show what is the stock status of the various vaccines. I'm going to show you one more dashboard, and when we get to our demonstration later, we will see a few more dashboards that are found in the two tools that Marta and Dorta will be sharing with us. This is a dashboard from a VLIMS, and it is showing the stock status of different vaccines at different levels. And in most cases, the VLIMS or the ELMIS may be able to drill down, like we saw in the VIMS system, where you can look at a larger geography and then drill into seeing why is this a stock out? Where are those stock outs? And you may have visuals such as this in the chart below.
Okay, so one of the really important things to think about as you think about digital tools is how are systems connected to one another? How does data move from one system to another system? So in an ideal world, you have a country LMIS and everyone in the whole country uses it for everything. That's the ideal world. That is almost never true. It's not true in the public sector. It's not true in the private sector. There are a lot of systems out there, and people will continue to use the systems they're using. And a lot of the local systems are very good. They're tailored to the exact use of the people in the actual facilities who are serving patients. So, but the question of how data moves between systems is a very important one. Because if you want to make decisions at higher levels in the supply chain, the data from the lower levels needs to move up there in some way. So one method of data integration is manual data integration, right? This is somebody typing the data from one place into another place. So on the top right, you can see what's a local system that's basically a complex Excel sheet. Sometimes that's printed out and then somebody types in the actual data into the LMIS. You might have the same thing with the warehouse management system. This can be true with a lot of different systems. One challenge that exists with this is if I said at this moment in time, where is the most accurate data? This is a good question if you have to make a decision at a particular moment. And so where the most accurate data lives, the most current data, is what's called the system of record. And so if the data from the lower level to the upper level only moves once a month, the system of record is at the lower level. The problem with that is at the national level, it's pretty hard to make accurate decisions on that basis. One of the other problems with manual data entry is that the rates of error are fairly high. And you think about if you're typing in stuff over and over, it's not that hard to make a mistake. If you enter the number 700 instead of the number 7, you can think about the kind of problems that would cause all the way up the supply chain. And those problems are really costly and time consuming to correct. The other issue that I talked about a minute ago is how current is the data, right? Is it a month old? Is it 2 days old? Do I know how old it is? These are key issues to think about. And data quality is a part of all of this, right? If you watched our preceding webinar, we talked about this in pretty great depth. But things like timeliness that I just talked about, completeness, right? Do all the data fields in the lower level system match to the data fields in the upper level system? This is really important to have visibility at a higher level. So this is one approach to data integration. What I'm showing here is a much more sophisticated approach, because as you may or may not know, connecting one system to another system is not easy. You have to map the fields. You have to be sure there's security as the data moves back and forth. You have to figure out what protocols to use. So there's a lot of complexity there. What exists now is something called an integration service provider. And this is basically a company who says, I'll take care of all that. So you tell me your local application, what data do you want to move to the country LMIS? How often do you want it to move? All that sort of stuff. And they're based in the cloud, and they will do this sort of stuff for a fee. Usually it's a monthly fee, depending on how many connections you have. But you can see the advantage of this, right? Is then nobody needs to type anything. The data is automatically moved to the cloud and then to the LMIS. And then at the LMIS, you can make decisions based on pretty accurate, pretty current data, and that results in better decisions.
Right. I've noticed a few people have put some questions in the chat, and if you can put your questions in the Q&A for later, that would be great and make it easier for us. We're going to look at some lessons learned, excuse me, in choosing and using and applying digital tools. And I think it's one of the big lessons learned, of course, is to keep the user at the center of your decision and in your design choices. Does the digital application, does the digital tool actually help the user do their job, or does it add additional workload does the user have the infrastructure consistently to be able to use that digital tool to make it successful? So they will provide the data and also use that data for decision making. So keeping that user in mind when doing the design is really important. And to complement that also is building a culture of data use around that digital tool implementation or application. You know, we talked about in the previous webinar, we talked about data review or data performance teams. And, you know, if you want people to use data, to take advantage of these tools to collect data, which will improve the accuracy of the data by using digital tools and the quality of the data, you want to build a culture of data use by showing them and giving them a forum or a situation where they can see success by using the tool with the data that they have. So these data review teams and are really an important part of that, or some kind of structure or forum in which to use data, whether it's a visibility analytics network or other kind of a forum or structure. As I said before, it's really important to design for sustainability into tool implementation, to think from the beginning, to plan from the beginning, who's going to own that tool, who's responsible for its maintenance and application, is there funding and budget to continue to improve that tool, to maintain a database and the servers needed to organize and hold that data, and to continue to upgrade the dashboard to be applicable to whatever the decisions are that are being made and the performance metrics that are being used. To use those dashboards, you know, it's very important that the dashboards are usable just like the applications are, to really support whatever the performance indicators are or the decisions that are being made. And finally, particularly if you have separate applications, it's important to integrate those tools with other information systems. The more that one digital application can be speaking to another digital application, you can avoid having to re-enter data, as Bill has talked about, that integration of tools, the better quality data you're going to have, and the more successful the application will be. Now I'd like to welcome our special guests, both who come to us from the UNICEF Supply Division. Dr. Conradson has been involved with the development of the data for management strategy for UNICEF and has been participating in the development of the DISC indicators and also has worked on these projects for the development of digital solutions for forecasting, supply planning, and stock management. And Marta Fernandez Arias is a supply chain specialist, and she's currently the project manager for the two tools that we are going to be seeing that they'll be demonstrating for us today. And that is the Viva and SMT tools. And so we're so happy to welcome you to this webinar and look forward to your presentation.
Thank you very much, Barbara, and thank you for giving us this opportunity to present the tools today. I will start with just presenting a bit of background on the tools, and then I'll hand over to Marta after to give a quick demo of both tools. So the stock management tool, some of you might already know it. This is a tool that was launched in 2006 by WHO. It was an Excel-based tool, and it's currently used in around 41 countries, specifically in Africa. In 2021, we have worked on transforming this tool into a web-based application that is targeted to the governments, to the country governments, and used in both vaccine stores in the national, regional, and district levels. This tool is a stock management tool that can be used for vaccines, but also for the supplies like syringes and other supplies used in the immunization program. It is currently being piloted in 3 countries, and we are getting ready to roll out next year globally. Next slide, please. So some of you know now the Excel-based tool, which looks like the tool here you can see in the top. This is in Excel, and of course, with using Excel, there are some challenges. For example, the fact that every year it has to be a new tool, a new Excel sheet, so it's difficult to see the trends over time. And also with the many formulas and very many sheets, it is a bit difficult sometimes to use it. There's also not been any systematic updates since it was launched, and there's no standardized training materials or guides. So this also can complicate a bit the use of it. So these are some of the backgrounds for why we, together with WHO, decided to move forward on developing this web-based application. There's also for this, because we of course are aware of some complications, at least at the lower levels, with having reliable internet accessibility. There's also a desktop application that can be used in those settings. There are different levels, as I said, that it can be used both at the national, regional, and the district levels, and it's possible to see the transfer of the stock. So when stocks are issued from the higher levels, it can be seen in the stores at lower levels in that country. There's different roles, and there's the admin role for the national level and for subnational levels, and also there's the store operators both at national and subnational levels in each of the countries. We are developing at the moment guides and training materials to support the rollout of the new version of the SMT. So what are some reasons to use the SMT? First of all, it's free to use. There are no licenses with this tool, and UNICEF is covering all the costs for the maintenance and the upgrades to the system. It is ready to use as well. We see this being a tool specifically targeted to countries maybe with limited technical or financial capacity, because there is no need to customize the tool. It can be taken as it is and implemented in the country. It has a simple and intuitive interface, which you will also see later when Marta is demoing the tool. And as I said, both the online and offline capability. As both Bill and Barbara talked about, it has the dashboard, so you can see the different key performance indicators, so it can be used to monitor the performance of the supply chain. The data is kept confidential, it's secure, so no one else has access to it, and the training will be provided by UNICEF and WHO to support the implementation in countries. We will also make sure that there's help available in a tiered process, in a tiered system, so new users of the system can receive support. The Viva tool stands for Visibility for Vaccines, and as Barbara was saying, this is a tool to monitor the stock status and to support planning of the vaccine supply plans and procurement. It was an Excel-based tool that was developed in 2014 and then turned into a web-based platform in 2016. Currently, around 40 countries are using the tool worldwide, and primarily at the national level. For this tool as well, the audience is the country governments, and also in some countries, the UNICEF offices are supporting the country governments in planning of their supplies. Next slide. So the reasons to use this tool is also that this is a free tool, and yeah, there are no licenses. It's just available online. It is also simple and intuitive, as you will see later, and it requires very little time investment to use it. So we have done a survey with users, and we can see that approximately they use around 15 to 20 minutes per month to enter the stock balances, which is the only information that needs to go into the tool from the government side. It offers visibility also of the international shipments, so there's estimated time of arrival and the quantities received, and this information is coming from the internal UNICEF system, so it's updated twice a week to make sure you have updated data for this. It makes projections of the stock levels based on the consumption and shipments coming into the countries, and then gives alerts and recommendations on how to handle different situations to avoid stocking out or having too much stock of the different vaccines. It also sends email alerts, so you don't have to go in and check in the system all the time, but that you will get an email every month, so you can go in and see if there are any specific situations that you need to handle. The training is available online. It takes maximum 1.5 hours to complete it, and after the training, you'll be able to start using the tool. The data is kept secured and confidential, as it is for SMT as well. So just to quickly compare the two tools to make sure that we're clear on what is what. So the SMT is an inventory management tool, so a stock management tool that is used in the stores, whereas Viva is used at the national level to see the shipments coming into the country and to support the supply planning on moving shipments around, so you are sure of having a constant level of the supplies. The SMT, because it's an inventory management system, is used daily, because every time there are transactions, this tool is being used, whereas Viva is used less frequently to just guide on the to see the stocks, but also to enter the stock levels once a month. The SMT can be used, as I said, at different levels, whereas Viva is used mainly at the national level. And whereas both of them are online tools, also the SMT has the offline capability. The tools are used by country government staff at different levels. And for the SMT, they use it to have the overview of the inventory, the cold chain equipment, the stocks and transactions. And the tool, the data that goes into the Viva tool is the shipments, as I said, coming from Viva, but also the stock levels that can be taken from the SMT tool. They're both free to use, as mentioned. The SMT, there will be some cost potentially associated with the implementation. Of course, the further down it goes, the more will need to be trained. But UNICEF is supporting with the facilitation, but the cost will often have to be handled by the country governments. For both of the tools, the data is stored in like cloud, and the software management and the support is provided by UNICEF. There's a restriction, of course, to both tools and who can use it. And as mentioned, the data is confidential in both of them. So this was the background on the tools. So I'll hand over now to Marta to provide a demo of both SMT and Viva.
Great. Thank you, Tord. Okay, so let Marta share her screen and go ahead and share the tools.
Perfect. Thank you so much. Okay, so I'm just going to share my screen. Please let me know if you can see it.
You see it.
Okay, perfect. So right now I'm on the SMT page. So this is just like a page that we have now for testing and training purposes. So I'm just going to log in. So there are different ways of logging in. In this case, I'm going to access with my Gmail account. So I'm logged into the system, and here you can see the SMT recognizes that I'm a user of Sierra Leone. In this case, the data that I'm going to show you is not real data for Sierra Leone. It's just dummy data that we are using for like testing purposes. As you can see here, this is the testing site. So as a user of the SMT, there are different screens, different functionalities. So the main thing that the user sees when they log into the platform is the stock overview. So the stock overview is going to show like a summary of the different supplies that are available in the store. In my case, I'm logged in as a store operator at the national store. But of course, as Dorte was explaining, the SMT can be implemented at the regional district stores as well. So the store operator will just see what they have in their own vaccine warehouse. So in this case, I have this number of different vaccines. And when I click on each one of the items, there is this a panel that displays on the right, giving me the different details of each one of the products. So this is quite useful for the a store manager to see or to keep track of the items that they have in store. You can see that for some items, there is like a red alert. So in this case, for example, for BCG, there is a different, I have different batches, and some of them are about to expire. For example, this one in particular. So because the expiry date is within the next 3 months, then the tool shows a red alert. That means that you need to pay attention to that particular batch. So we have this system of alerts for expiry dates, for VVM, and also for the quantities. If the quantity of one particular item goes below what you have set up as your minimum level, then the tool will also give you an alert. So this is just for the user to be able to keep track of what they have. Then we have a different tab, which is the store data. So this is just a summary of what is happening in terms of storage. So we have the required capacity for this particular store, and then below there is the actual capacity. So this is where the user can keep track of the cold chain equipment that they have in the warehouse. So the user will come here and manually just add their cold chain equipment. So in this case, you can see I have some freezers, walk-in coolers, and so on. So we have added a master data of the pre-qualified, WHO pre-qualified cold chain equipment. So the user can just select their manufacturer and the equipment model, and then automatically the SMT is going to calculate for them the gross and the net capacity. So this is to kind of help users with the calculations as well. Of course, if you have some cold chain equipment that is not on the list, you can also add it manually. So we are just offering the option to kind of facilitate that the user doesn't have to do all the calculations. Then we have the transactions. So we have arrivals and issues. As you see, we have tried to keep the interface very simple, so to make it easy to use and user-friendly, just following kind of the same structure as the Excel SMT, but in a more kind of a simplified way. So we have the arrivals. So here the user can just keep track of all the items that have been received in that particular vaccine store over time. So we have just like a list of arrivals. So I have the arrival date, then a reference number if available, and then the receipt type. So it can be like a starting balance that I have added manually, or it can be like arrival of vaccines that I have received from other store, for example, and then different state, whether it's draft or completed. As you can see here, there's no details of what I have received, but if I go and view the details, then I can like review for this specific arrival on that particular date. These are the details of the products I have received. The issuing screen works exactly the same. It has the same structure. So you have just the issue date, the reference number, the issue type, and the recipient store and the state. So it is the same. You can just click on the specific issue and then see the details. Okay, so this is just for the transactions. We have also like printing functionalities to be able to like print vouchers to issue to the lower stores and things like that. But as you see, these are like very simple functionalities. We have an additional functionality, which is for the temperature login. In this case, this is like a manual temperature login. It's just to keep track of the minimum and maximum temperatures recorded in each one of the cold chain equipment, and also the alerts, if any. So based on what the user has entered on the store data, like the number of different cold chain equipments, those items are going to appear here. So we have, for example, freezer 01 and walk-in cooler 02. So for each one of the items, the user can now enter the minimum temperature registered during the month, the maximum temperature registered during the month, and the number of low temperature alarms and high temperature alarms. And then we have an additional functionality. This is a new thing that has been included in this online SMT, but it was not available in the Excel base. So this is like a new functionality, which is physical counts and adjustments. So this is to facilitate that the user, if, for example, at the end of the month, they do the inventory, they conduct the physical count, to be able to kind of correct any discrepancies. So what the tool is displaying here is just the list of the items with the batch number for each, And then what is the system quantity or the theoretical quantity that you should have in your warehouse based on what you have entered as the arrivals, issues, and so on. So the user can then count and enter here what is the actual counted quantity, and if there are any discrepancies, then the user can justify the discrepancy and select whether you want the system to automatically correct those quantities. So this is basically the main functionalities. For all of them are manual for the physical count and adjustments, temperature, and issues. For the arrivals, there are two different options. So if we are receiving supplies from, let's say, for example, from an international supplier, so in my case, I'm a store operator at the national level, so I need to enter this arrival manually. But if you are issuing supplies from one store using SMT to another store using SMT, the arrivals will be logged automatically, since it's a web-based system and the different supply chain levels will be connected. So this will also kind of reduce the errors related to manual entry, and also reduce the time for data entry as well for the users. So all of this information is then compiled to generate a variety of reports. So we have, as you can see here, we have many different reports. So we don't have a lot of time, so I'm not going to get into the detail of all of them. I'm just going to show one of them, which is the immunization supply chain performance. So this is maybe the most important. So I will just select my store. In this case, since I'm at the national level, I have the option of generating reports for my level, but also for all the districts below me. Okay. So I will just select the months, the period. Okay, so I want to generate a report for my national store from January up to November, and I select generate report. And then I have a number of different indicators that I can monitor. So I'm going to select all of them. And you can see that based on the information that we have entered, this report will just show me like a dashboard, like a graph of the temperature. So we have like a temperature chart for each one of the cold chain equipment. So you select the different temperature ranges, and the tool just generates the graph for you, so you can track the alarms and the temperature and so on. We have another graph, which is for the cold chain functionality. So this is basically giving the user some information about whether the cold chain equipment you have in your store is functional or non-functional during the months. So as you can see here, we have the different, the walk-in freezer, different freezers. So some of them were functional, some of them were non-functional during November, and we have as well the percentage functionality. Okay, so this is to keep track of each one of the equipment that you have. There is a separate chart for wastage as well. So here the user just selects the item, the vaccine, and they can track the wastage. Of course, this is, we are talking about the vaccine warehouses. So this is closed vial wastage. So for example, in November, we can see that there was like a 4% wastage of BCG. And then you can see also the wastage by type. In this case, it was due to expiry. There's also some information on the availability of supplies. So full stock availability just shows whether the different items were available or not during the month. So in this case, all the items were available. And we also have a stock out days. So in case any of the supplies were not available, with this graph, we can also track how many days we were out of stock. In this case, we didn't have any stock outs. And there is another chart, which is stock according to plan. So this gives us some information about not just whether the item was available or not, but whether the actual quantities were kind of sufficient or were adequate. So we have like the minimum and the maximum level, which are calculated based on our forecast. And then the blue line represents the actual quantities that we are keeping in the store. So this is basically just like the summary of the different graphs, but as you can see here, there are many other reports as well. So in the interest of time, I'm going to switch and I'm going to show you the Viva platform as well. Let me see if I can move this one. Okay. So this one now is the Viva platform. So as you can see, it is very similar to the SMT in the way how we log in. It's also like a web-based platform. So I'm going to log in with my Gmail as well. Okay, and I will go directly to the charts. So this tool is connected in a way to the SMT. So the idea is that the user of the SMT takes the information on the available supplies, and then they enter that information into Viva. And Viva is going to take this data, so how much you have in your store right now, and it's going to put it together with information from UNICEF Supply Division on upcoming shipments. And these two pieces of information is what the platform is going to use to generate the dashboards. So I'm showing here, I'm now the user of this training country. So this is my main overview of the national vaccine store. So basically I can see a list of the different items that I have, the stock level in doses, and then some different alerts. There are color-coded alerts. So if the situation is okay, I have a green alert. If I have a stock out or a stocking out, I will get like orange or red. Or if I'm overstocked, the yellow color. And which is the most important or the most valuable of this tool is that I can also see the shipments. So if you see this plain icon, so I can see that on the 9th January of next year, I'm expected to receive 300,000 doses of OPV, and this is the PO number. Okay, and for TD, the same. I can see when I'm going to receive supply, so I can plan accordingly. So for each one of the items, if you want to see more information about that particular shipment or the stock status of that vaccine, you can also click on the specific vaccine. And we have this product specific charts. So this is the chart for the training country for the national store for OPV. So we have our minimum and maximum levels. The blue line represents the stock projection. So as you can see, this goes from 2021 August up to May 2022. So this is like an estimated projection that the tool is creating for the future. So how much you are expected to receive from UNICEF, how much you are expected to use, and based on that, whether you have any risk of stocking out or overstocking. And this blue bar here represents the arrival of vaccines in country. So this is basically it. This is just a little bit of the summary. Then I forgot to mention, but all the charts, both in Viva and the SMT, can be exported as a PDF or Excel. So you can use this information also to coordinate with partners or for reports and so on. So yeah, I think I'm going to stop here and just to allow some time for questions or comments from the participants. So it's back to you, Barbara.
Actually, I'm going to turn it back to Bill. Thank you.
Okay, great. Well, this is the end of the webinar for today. We've talked about identifying tools for data collection and visualization within the immunization supply chain. We've talked about considerations, challenges, lessons learned when you're trying to apply digital technologies to the immunization supply chain. And obviously, we've also learned about SMT and Viva. So thank you guys for that. We now have time to address a couple of questions. As Barbara mentioned, you'll be getting a follow-up email with additional resources, a recording of this webinar, especially if you want to share it with somebody who couldn't be here, and also evaluation form to help us continually improve these webinars. So just as a reminder, we hope you can join us for the webinars on January 25th and February 1st. when we're going to dig into data triangulation. As I think Barbara may have mentioned, anyone who attends all 5 of the webinars in the series, either live or recorded, will receive a certificate of participation. So I guess with that, Barbara, we could throw it open. We have time to answer
some questions. And I just want to add to what Bill said about the follow-up email. We will also, if some of you are keeping up in the chat, there was a request for some about data audit and data quality tools. And so we will share some suggestions for data quality tools in our follow-up email, and we'll send that to everyone along with the PDF of the slides. And also we'll send our colleagues, Dorta and Bill have been typing some answers to some of the questions in the Q&A already, and we'll be sure to share the Q&A report with you. One question that came in from Adriana, which I think is a very important question for considering, is, what are your strategies for piloting data and digital tools, data tools or digital tools, in terms of what the kinds of contexts in which they are piloted. And it's true, oftentimes you want to see if it's going to succeed. So you choose an area to pilot in that has good connectivity, skilled staff, and so forth. But it is important to think about the range of contexts in which people work and the range of people who you expect to use those tools. We've had experience with some digital applications in Indonesia, not specifically for a vaccine, but for stock management and distribution planning and so forth. And we purposely piloted those tools in a variety of contexts, in places that are hard to reach, places that have poor connectivity, and other issues, so that we could see what the limitations and bottlenecks were, and to address those and try to find ways either in the architecture of the digital tool to help with overcoming some of those things, such as how the offline capability of the tool works and so forth. But as I said before, it's really important when you're designing or developing your strategy to keep that user in mind, all the possible limitations, the skill of the user, and so forth. I know. And we didn't talk about this, but one of the things that we've had with community-based workers is low literacy rates and use and difficulty using digital tools. Specifically, there's an application, a pilot of something called it's H2. I'm going to get the acronym wrong, maybe Amos can help me, but it's the use of being able to transfer something that's written or H2, I'll remember it, I'll send it out to you all, but it's how do you move data from paper onto, thank you, HP2D, thank you, Joseph, HP2D, which actually helps user move data from paper into a digital tool, so that when you have a problem with people's ability to use a cell phone, just taking a picture of the data and digitizing that. So that's in a sort of a pilot experimental phase. They're using in supply, and Kenya is using that at the lower level. So you do need to keep into consideration the context in which the user will use the tool and their capacity and the connectivity issues.
Barbara, if I could add just one thing.
Yes, please. Yeah.
In any software development, hopefully you're not getting the software or the digital tool and then going, I hope this works for everybody. In an ideal world, you do what's called requirements gathering, right? You go out to the population and see what do they need, will it work? And this is true if you're developing software from scratch, or if you're buying software in a commercial environment. Because if half your population doesn't have internet access, your tool needs to deal with that. I
think we had another question. How, and I'm not I'm not sure I quite understand the full question. How is digital ecosystem and ease of use of digital tools by cold chain handlers assessed prior to introduction? If stock management and logistics is not real time, it may give false data, which is true. Do managers seek for regular qualitative feedback? In terms of, let me ask, because Dorota and Marta, if you have any ideas on this in terms of when you all were developing some of the capacity and SMT for the cold chain part of it, what were some of the considerations in terms of? I think the data is entered on a monthly, but can be entered. Well, it can be entered at any time, correct? So. Do you have any comments on that?
Yeah, so I'm not sure I'm understanding the question. So for the cold chain, the data is entered kind of once at the very beginning, like the cold chain equipment, and then if there are any changes to the functionality, that gets updated when required. And then for the specific temperature data, then yes, it is entered once a month.
Right.
Yeah. So the expectation is that the users will still use their fridge tags or whatever it is that they're using for their kind of daily monitoring of the temperature, and then at the end of the month they just enter the minimum and maximum and the alarms into the SMT, and that's what's going to build the reports.
Right. Yeah, and this, I mean, not specifically to cold chain, but this idea of real-time versus real-time data versus periodic data of, sometimes our reporting systems, particularly if you're moving from data from a paper system into an electronic system, are often on a monthly basis, and so forth, which obviously you're not getting real-time information. But obviously, the more you can monitor, you can automate the system so that it becomes a transactional system. And the same thing with the temperature monitoring, that you're connecting those remote temperature monitoring devices to the system that can do real-time monitoring. You're not going to get false data. You're going to have routine data as it's occurring, as it's updated. I encourage you, Satir, and anybody else who's interested in this to attend the WHO webinars on the temperature monitoring and the cold chain temperature monitoring. They're going into all the different kinds of aspects of the different devices and ways of managing that, and how those interact and what are some of those considerations. So check out those webinars. And I'll be sure that link is in the follow-up email for you. I know that others of you have probably had some experience with those, and feel free to share those experiences in the chat with us as well. I did see in the chat, actually, I have a question for Marta and Dorota myself. You mentioned that SMT, the web-based SMT tool, is being piloted in 3 countries, and I know Sierra Leone is one of them. What are the other countries that are in the pilot, and how is that going? What's the progress with that?
Yeah, so it's Sierra Leone, as you mentioned. So we have just completed the training 2 weeks ago. We did the training of trainers at the national level, and then the cascade training for district level. So they are just starting to use the tool now. And then for South Sudan as well, we completed the training recently in the previous, a few weeks ago as well, the training of trainers at the national, and they are now planning for the cascades. And the third country is Cameroon, which we are planning to train beginning of December.
Okay, and if other countries are interested in joining and using the tool, what is the process for them to get on the list?
Yeah, so we have some countries that have already shown interest. So our plan is to finalize the pilot now mid-December, so we can also kind of finalize the strategy for the trainings. We are testing different approaches like remote training, face-to-face. We are testing the materials as well, and kind of like fine-tuning some of the things in the platform, also like getting feedback from the users. So the idea is that we will be able to enroll new countries starting from January. But if there are some countries that are interested in either like knowing more about the tool or understanding the onboarding process or things like that, they can just get in touch with us. So we have this dedicated email address, which is smt@unicef.org. And and even for the Viva platform is the same. We have viva@unicef.org. So they can also just send us a message. And
okay, and I'll include those in the follow-up emails. Great.
Great.
Thank you so much for everyone for joining us, and for Dorta and Marta for your great presentation and for teaching us all about the two tools. Very, very exciting. And we look forward to your participation in future webinars. So take care, everyone, and thanks so much for your questions. Bye, everyone.
Thank you.
Thank you. Bye.